Evening, everyone, and welcome to this webinar, which is hosted by final year students from tourism as part of our meeting incentives, conventions, and exhibit module. Our group consists of three students, including myself, that is Adele, Claire, and myself, Fatina. And I'll be the moderator today, and you'll have come to join this webinar through the understanding of our poster and marketing member. This webinar will be all about psychological health during this pandemic, particularly on how students face psychological health issues during this crisis and ways this could be handled. Talking about psychology, you guys might be familiar with who our respective speakers are, Dr. Joel and Miss Cynthia, whom both have a great understanding and knowledge about psychological health. Before I bring out first speaker, I would like to say a huge thank you for everyone who is here for the webinar, and we hope that this would have a great impact on every one of you. So I would like to say a few words about Dr. Joel. Dr. Joel started teaching psychology since 2013. He is currently the senior lecturer program leader at Asia Pacific University of Technology and Innovation. He previously held a senior lecturer position at Southern University College, SUC. During his time at SUC, he was also the head of Department of Psychology. He has published Scopus and WOS journal articles, and he was previously involved in a national research as one of his topic was selected by MOHG under FRGS in 2017. He received his master's abnormal and clinical psychology from Swansea University, Wales in 2012, and his PhD educational psychology from University of Technology, Malaysia. I kindly now invite Dr. Joel to begin his presentation.
Thank you, Fatina, for your introductions. So I'm really pleased today to be invited for the sessions, and let me share my screen with you guys. So today I'll be presenting about topics pertaining to resilience. As probably now everyone know that COVID-19 is a global situation that everyone is going through now. So as a student or as an individual, everyone has difficulties coping with the situation now. So today what I have prepared a topic pertaining to resilience, just to give you guys an overview about what we can do as an individual when it comes to a pandemic like COVID-19. And today is Friday, and I hope everyone has a good Friday. And hopefully after the session, you'll be learning something from all of us. Okay, so without further ado, okay, so let me share with you this. So I think everyone knows that this is the, common icons nowadays that everyone is facing, or seeing. Maybe you know yourself that you have to wear masks, and you always have to sort of like sanitize your hands, so on and so forth, because we have the COVID-19 situations, right? And this virus is really killing a lot of people, taking a lot of our energy and effort. So as an individual, right? So in psychology, what we can do, so hopefully the information which I will be providing to you later, you can get some information from there, and then hopefully you as an individual, you can sort of like take care of your well-being, because of COVID-19 literally sort of like affects a lot of people, especially financially or psychologically, physically. So today what I'll be presenting, I'll just cover a few resilient factors which I believe that not only students but any individual that will benefit from. So this is a question that I want to share with you. Maybe you have a sort of like, I hope it can resonate with what you are going through now. It's like, can I survive online classes? I know that a lot of individuals, especially maybe including your friends or you yourself, you come across with situations like you never really well, maybe you previously you have taken some online classes, but not as much as we are having nowadays. So looking at current situations, right, a lot of individuals, especially university students, they are having difficulties in terms of whether they have the technical issues with the internet, or whether they really not really like able to learn online, because some kind of difficulties there in between the speaker, the lectures, and the individual, the student. So looking at these situations, right, as an individual, normally we will have a lot of doubts, a lot of worries about ourselves. Can I cope? Can I overcome this situation? Because this is something like the COVID-19 essentially is like it's an emergency approach for, the online classes is an emergency approach for all the sort of like most of the universities or even education institutions. They will use this approach to overcome the teaching and learning activities, right? Because we have no choice. We have to keep our class carry on, and so if individuals, they might think that I cannot cope, so they start to become more and more pessimistic, right? They start to become more and more negative. Well, what is going to happen to me? All right, when I literally in front of my PC learning information from my lectures, and I literally have no idea whether I can survive or not, whether I can pass my assignment or exam or stuff like that. So we do have optimistic individual, which I'll be highlighting later on. But the main concern is that most of the individual, they might start to feel, they start to have more doubts about themselves, and they start to feel, they're not going to make it. All right. So for example, I give you one example is that you look at this case, is that we have individual, who thinks that, it's difficult for me to overcome, and I don't really think I can survive. So in most cases, right, in most instances, these kind of individuals, they be sort of like, I would say, perceive themselves as like, I'm not going to make it. So should we say that they are pessimists? In this case, you could probably argue that they are quite pessimistic about the situation. So they will say, no, I'm not going to make it. But of course, on the other hand, you do have individuals who really believe that the situation is not as bad as they think. Well, obviously, you may have friends that say, "Oh, well, I don't think I can make it." But we do have individuals. They say, I think I can make it, and I think everything will be okay. Well, just like this young gentleman, right? So you can see he's very confident with his what do you call his abilities, or his overall sense that he could essentially overcome this pandemic, especially this online teaching and online learning. Well, so based on these two slides that I have just shown you, you can see that we have individual differences in terms of how people perceive themselves in times of crisis, right? In times of uncertainties like COVID-19 pandemic. So what I really try to bring here today, the first resilient factors, which I'm going to show you today, is optimism. Well, this is something not really new to a lot of you guys today. I assume that some of you probably you have sort of like used the word before. I'm quite an optimistic person, right? So this optimism literally suggests that someone really think that an individual believes that he or she is able to really see more positive things rather than negative things or negative events in his or her life or situations, depending on which context we are looking at. So the first resilient factors is known as like optimism, right? Why I try to, and I would like to share with all of you today, is because of this is not a new, I should say, a psychological construct, or it's not a new resilient factors. In fact, studies have been showing that optimism, right, or so-called this particular psychological variable, is really crucial for individuals, any individuals ranging from young adults to older adults in terms of how they can basically perceive the situations. So I have sort of like taken some pictures about the studies, recent studies, especially done after the COVID-19 situations, right? And again, studies have once again proven that optimism is really important in times of uncertainty, especially it provides the individuals to overcome the anxiety and the doubts that they might have during this difficult moment. So I really want the students or any audience today to bear in mind that as an individual, what you could do to yourself. Okay. Of course, some students and some studies have found, well, during this difficult moment, especially this COVID-19 or even online teaching, right? Being over optimistic isn't really a good thing. Well, in research, we call optimism biases, right? So we are not going to talk about that today. Of course, if you are being too optimistic about anything, that isn't really a good thing, right? I mean, so we have to differentiate between a so-called a normal, what do you call typical optimism, and those being a bit delusional. All right. So what I'm trying to say is that during this difficult moment, right, as an individuals, right, hopefully starting from today, the take-home messages that I'm going to give to you is that hopefully you need to start thinking about whatever is happening around you. You need to really nurture the optimistic thinking within yourself. So in research, or maybe some of you might wonder, so do we have any potential interventions or treatments that, or maybe programs that can really improve individuals' optimism level? Well, yes, that is. And in fact, for information on optimism, we in research or in psychology, we have different types of researchers. They come up with different types of optimism, right? Despite that, one of the widely used optimism we call dispositional optimism is known as the one of the personality traits. Meaning to say that it's like a personality trait. It's quite relatively difficult for you to nurture this trait. Still, research have found that sort of like we have some programs. One of it is this, which is I'm going to talk about. It's called Best Possible Self, and for this particular BPS, right? Studies have found that essentially those individuals who have gone through a certain episode of BPS, right? Essentially, they have sort of like improved their psychological well-being, especially when they have go through a certain numbers of the BPS, and towards the end, studies have found that essentially their optimism level increase, and of course with their psychological well-being as well. And at the same time, we look at the negative affective emotions like anxiety, fear, and all these things. So most of the study have supported that BPS is very crucial to reduce in reducing this kind of negative emotions. So, so what do we mean by BPS? So essentially, this is one of the potential positive psychology interventions that we have today. It's really useful in instilling positive beliefs and enhancing positive thinking, like what I mentioned just now. And essentially, it requires the individual to write something about themselves and think about what they might expose, what they might experience in the future in best possible ways. Okay, again, I have sort of like taken the pictures about the study that has been recently, published, right, and which is after the COVID-19 situations, right. And you can see essentially the whole research. Basically, nowadays the trend is like focusing on more and more positive psychological intervention, aiming to sort of like improve the individual resilient factors. One of it, like BPS, is more inclined to improve the optimism level. So if optimism is not really an important resilient factors, I would assume that we won't see this kind of studies, right? So that is the first resilient factors I would like to highlight, and I would like to share with our audience today. And apart from optimism, some of you may think about, so I know that optimistic is very important, especially during this difficult moment. But again, I still don't think that I can I can cope with the situation. Especially, I don't think I have the skills. I don't think I have the abilities to deal with these situations, especially when it comes to online learning, right? A lot of our students, they might say, I find it difficult to appreciate and comprehend the knowledge given by my lectures compared to when I'm still on campus, when I got to see my lectures face to face and I got to learn things hands on. Well, of course, this kind of skills I would say is very crucial. It's very important. I can't deny that. So in psychology, we talk about self-efficacy. Self-efficacy is one of the most commonly cited psychological variables, or if you want to put it as resources or resilient factors. So what do you mean by self-efficacy? Essentially, this self-efficacy sort of like brought up by our famous psychologist Albert Bandura, and Albert Bandura sort of like defines self-efficacy as an ability, individual's ability in terms of executing certain course of actions, right? Meaning to say that, and he say self-efficacy is multi-dimensional and is a domain-specific construct, meaning to say that you have a specific self-efficacy for online learning and you have a specific self-efficacy for academic performance. You have a specific self-efficacy for, I would say, cooking. So this basically, nevertheless, the whole idea, the gist of self-efficacy is to say that, as an individual, in our mind, in ourself, within ourselves, we do have certain level of this kind of judgment. And this judgment, why is it so important? Because this judgment will be able to allow you to believe that you can do it. Okay, you can do it. Why you can do it? Because you have the skills. All right. So again, I have now let me show you these studies. Again, these have been recently conducted, by different groups of researchers. But nevertheless, feel free to search online, about this kind of studies and get to know more about self-efficacy. And for today's sessions, I'm just going to brief you guys about the importance of this kind of resilient self-efficacy. Just imagine that today, or maybe some of you, because today is Friday, perhaps next week onwards, right? Can start to think about whenever you start to engage in online classes, right? What typically you face, okay? Well, you have to absorb the information and knowledge from from the lectures. You have to know what to do, how to do, and why you need to do it, right? So all these things basically covers certain levels of ability. Well, in psychology, we sort of like we really pay attention to how individuals think that they have the abilities and they have the skills in terms of how they can really execute the performance. So bear in mind during this COVID-19, how as an individual, as a student, right, you really need to think about, well, since now everything goes online, what about my self-efficacy? Do I ever feel that I'm not a capable person, or I always think that I'm not good at this and that. That is something wrong about yourself, and you don't have the skills, and you start to believing that you can't really excel, or you can't really cope with the difficulty. So this is like for a very good time for you to start thinking about yourself. So I have a suggestion for some of you here today. Maybe you can try to search for this information. Some is for this particular read for your reading for the weekend. You can just look at this author and by Harvard, and then essentially what Harvard suggested is that basically he mentioned about things like how you as an individual, how we can really improve our self-efficacy from time to time. And he explained this in relation to motivation, because it's very easy to understand that once you really think that you have the skills and ability to do something, then perhaps you have the motivations of doing it. Okay, so this is one of the remarks, or sort of like informations that I took it from the book. Low self-efficacy beliefs unfortunately impede academic achievement, and in the long run create self-fulfilling prophecies of failure and learn helplessness that can devastate psychological well-being. So basically the gist is like, is very important for us as for an individual to really take care of your self-efficacy. So these are the two resilient factor which I would like to share with you, all of you today in front of PC. Maybe now you start to think about, oh, I think I really had this issue. I really think that, I don't have this so-called, I'm not being really optimistic about situation. Everything when it comes to online or when it comes to school related matters, I always say, oh no, it's going to be a bad thing to me, and then when it comes to self-efficacy, maybe you start to think that, I don't have the skills, and then you start to don't really have the motivation to learn again. So today, I really want you to take the take-home messages that I have from my part is that I want you to be resilient. At the same time, think about yourself. Okay, so that's all from me. I'll pass back to our Fatina. Thank you.
Thank you, Dr. Joel, for such an informative presentation. I'm sure many of us has learned something very important and knowledgeable information through your presentation. He has addressed about what psychological health is, how it has affected us on a daily basis, and what are some general causes of psychological health, and as well as impact during this pandemic. Dr. Joel's presentation has concluded about self-efficiency and motivation to do build and your psychological health overcome this difficult time. Before I invite the next speaker, Miss Cynthia, I would like to say some few words about her as well. Miss Cynthia is a psychological lecturer and licensed and registered counselor at APU. She holds a master in counseling from Help University and is a member of Lembaga Counselor Malaysia. She is also a certified reality therapist and obtained the Choice Theory Reality Therapy certification from William Glasser International, USA. She has 8 years of experience, inclusive of counseling and supervision. She is also a certified counselor supervisor and has obtained the qualification from Idaho State University, USA. I kindly present to you Ms. Shobha.
Okay, thank you, Fatina, there for the introduction. Okay, hi everybody. Hope you guys are doing well. It's going to be towards the end of the working time and everything, and it'll be like TGIF Friday. So I hope you guys are all hype and in a good mood because the weekend is coming. Okay, let me just start. I'm going to talk about managing mental health and coping during a pandemic. Okay. So before I go into my presentation, we will look at some comics, which is some situations and scenarios, something which you guys can basically relate to, something which is familiar, okay, which you have experienced during this pandemic. Okay, as you can see here, during a pandemic, we face different kinds of situation. Most situation basically give us the uncertainty that triggers our anxiety to go through daily life. Okay, let's take a look here at a few comic strips here where we can relate to during this COVID-19 pandemics. Some of this is also known as the pandemic blues. As you see the first comic here, it talks about homework strategies. I'm sure students here, you can roughly relate to what it's trying to say here. Say when we have an assignment, right, and we are doing it, so we have to sit and complete the assignment, say for 2 hours. But do we really sit down for 2 hours? We can't really sit for 2 hours. We feel agitated, we feel restless. So we get up. We get up and like what the girl is trying to do, we dance around, we walk around, we try to go and disturb our pets, we start to go and play with our phones. And then when we come back to our workstation or workplace, where in the house it is, we see that the time has already gone and we are rushing to meet our deadlines. So these are some of the distractions that we face. Next will be the environment that we are in. So basically, studying from home or working from home. So the environment, our environment, is it conducive? Is the environment helping? So many things can crop up, many uncertainties. One will be the internet went out again. Okay, this is something that we cannot control. Sometimes the line may be bad, the connection may be bad, it may be raining, there may be a slight storm outside, or we may face some technical issues where we cannot hear what the other person on the other end is telling, our lecturer. Or sometimes it can be the teacher's connection is bad, the lecturer's connection is bad, and the students get distracted and they start to do their own things during the sessions. Okay, or we have other distractions like family members, friends walking in behind us. And the last one will be someone unplugged the Wi-Fi router. Okay. Some other certainties that we face is that we've been home for quite some time. So we do not go out because of the pandemic. We limit ourselves. So we may tend to get bored or frustrated. And sometimes we ask ourselves, it feels like I've been inside forever. It feels like I've stepped out to the green for like so long. Okay. And we are unable to attend activities that we like. Okay. Sometimes we don't even get our deliveries in because due to certain issues. Okay. And when it comes to our mental health, there we have so many things that's going around. Fake news, hoax news. Okay. People say that certain drinks can cure COVID-19. So all this thing. And also loss of motivation there. Like you can see the girl here. I wrote one sentence and now I'm exhausted and she's gone back to sleep. So this is some of it that we actually face during this pandemic time. Next will be on the mental health part. This will talk about how we react when we step outside of the house, outside of our home. Some of us has already set in our mind that when we step outside of our house, of our home, it's like the scenes from the movie Zombie Apocalypse. Okay? We are afraid that everything we touch, whatever we do, we will get infected. So this can actually create panic attacks in us. Or when we go out, sometimes we tend to notice that our heartbeat rises and we tend to have difficulty in breathing. It's not due to our health problems, it's due to the anxiety that we have created within ourselves because of the situation. So the obvious issues we face during a pandemic, fears of infection. So every one of us go through this, fears of infection. When we go out to get our groceries, we are like on a supermarket sweep show. We do it very fast. We are afraid because whatever that we touch, we feel that, oh my God, if I didn't sanitize my hand, I might get infected. If I just pull my mask a bit down, I might get infected. So we have this running in our mind. Someone sneezes 4 or 5 meters away in the other lane, we get scared. The air is contaminated. Frustration and boredom. When we are in at home for too long, when we don't go out, we tend to get frustrated. We tend to get bored because we see the same environment. We see the same people. And little things tend to irritate us, tend to agitate us. Inadequate supplies, okay? During this time of pandemic also, many of us face loss of jobs. And some students who are studying overseas, we face finance issues. Okay, this is also something which is very concerning because it can affect us in our mental health. We keep on thinking about it. How am I going to proceed to the next semester? How am I going to pay my bills? How am I going to pay for my loans? Inadequate information. We don't get information from proper source. Everything's that forward to us, we tend to believe it's true without checking and seeing whether is it the true information from the legitimate source. Social relationships are strained. Domestic violence on increase. When we are locked down in the house, we get frustrated. Whereas if we don't have a job or we lost our job, that even adds to it. We tend to fight with our loved ones. We tend to fight with our partner, with our spouse. And during this pandemic time, research has also shown that domestic violence has increased in household. And one of it could be because of frustration and finances. And lastly will be academic. We struggle with online learning because it's something new to us, something which has been introduced to us only last year in the year 2020s. For those students who are coming in, especially the first semester, first year students, after you have finished your high school, you come in to gain an experience at the university, meet your friends. It's a whole new, different era of your life. But then you have to go through it starting with online. So you may not be able to make the friends you need to make. You may not, some of y'all may not even know who's your classmate because the camera is turned off most of the time. So in terms of coping with academic, you find difficulty there. How does it affect our mental health well-being? It gives us hopelessness. We lose hope. We feel that there's no hope. How long this pandemic is going to go on? The lockdowns are like open, close, open, close. We don't have certainty how long. No one can tell us for sure how long it's going to take. 2 years, 3 years, 5 years. Stigma. Stigma comes in, especially when, say, we are affected with COVID-19 and we recover. People tend to look at us differently, like as though we are still infected with an uncurable disease. Our friends start to make fun of us. Some of them may distance themselves from us because they are afraid that by talking to us, they might contract the illness. So stigma can also affect a person's mental health well-being during this time of pandemic. Individuals feeling under pressure and children needing more attention due to uncertainty, due to loss of jobs, due to restrained movements, people are pressured to stay at home. Sometimes we may not get along with the ones we stay at home, but we don't have a choice now. Because of this, we have to restrict our movement, restrict going out. So we get frustrated. Our workload adds, we can't go out to relax ourselves. Okay, children find it difficult to cope with online teaching. It's new to them, especially younger children, which adds pressure towards parents because parents have to deal with their work and with the children also in managing them in terms of their schooling, their homework. Lost and grief. Many of us have lost our loved ones due to this pandemic. It can be through to the illness. It's either they've been affected by the illness and they didn't make it, or some of them who cannot take the pressure of it, of the lockdown, of the pandemic, they resort to suicide. So loss and grief has also affected our mental health during this well-being. I'm sure you guys have been wondering, you never thought about loss and grief all this while. Yes, this has also been one of the factors during this pandemic, and the suicide rates has increased during this time. So how do we manage our mental health? Not only for this current pandemic that we are going through, we may never know what the future holds for us. In future, if we were to face any pandemic, how do we manage our mental health? Our physical self is something that we can see, so it'll be easier for us to manage. But our mental health is something that which we cannot see. Only we ourselves will be able to know how we are feeling and what's running in our thoughts and our emotions. So there are 8 ways here how you can use these tips to help you to manage your mental health. Stay informed. Take practical steps to protect yourself and your loved ones. Do not lose that human connection, that human touch. Keep in touch with each other. You may not be staying in one house, in the same country. Call, have Zoom meetups, WhatsApp calls. Protect yourself. If you're staying with your family and you have those who are under the high risk category, make sure when you go out, you sanitize your hand, you use your mask. When you come back, you shower, you do the necessity to take precaution, not only for yourself, but for those who are staying with you. Engage in healthy activities. Try to do some yoga if you guys like to, online, some online dancing, some activities where you can watch the YouTube, and you just to keep yourself healthy so that you will feel happy. When you keep yourself active and healthy, your body releases endorphins. So your body feels good and you don't feel so stressed. Or if you may go out to the park, which is right in front of your house, pick a time where there may not be many people there so that you can just go and have a jog and come back. Whichever that makes you feel better, for you to at least unwind. Make sure you have your medications ready, at least 1 month supply. For those who are on psychiatric medication or other illness medication, be in touch with your pharmacist. Make sure that your supplies are available. And if it's not, ask them, when will it be available? Will you be able to get it from another place? So that this doesn't increase your anxiety level, your panic level. So that when you go back there with 2 tablets left and the person says that, oh, I'm sorry, the next supply will come in another 2 months, you will start to freak out. Stick to regular routines as much as possible. Just because we are attending classes from home, online, and we're working from home, continue your regular routine. If you wake up every day, shower, and go to class, do the same thing. Do not neglect your basic grooming, brushing your teeth, showering. Some of us may not shower, some of us may not brush teeth and attend classes. Treat it like as though you are going to campus for class or you're going to work. So groom yourself. When you groom yourself, you feel better. You feel healthier, you feel fresh. Stay connected with your family, friends, and other support networks. So make sure you know that the nearby support that are available for you. It can either be friends, it can either be family, it can also be counseling centers where you can get support. Try as much as possible to be positive and relish the simple things in life. Try to look at things from a positive angle. Try to make the best out of it instead of just whining and groaning and moaning. Try to look at it at, okay, this is something challenging for me. I will make the best out of it. Help others through peer support and neighbor checking. So make sure you keep in touch with those around you, that they're feeling okay. Feeling okay does not necessarily mean feeling okay physically. Feeling okay mentally, not down, not depressed, that they have somebody to talk to. It's okay to talk to your pets and your plants, but you need the human connection. You can't be talking to your pets and your plants all the time, right? So you need that human connection there. Avoid tobacco, alcohol, and drugs. So this is the time where you do not rely on tobacco, alcohol, and drugs, because it can lead to addiction if you are unable to control yourself. This sounds familiar, especially for those who are seeking for help, for mental health. Okay? I'm sure you've come across some of these sentences. People will think I'm losing my mind. People will think my life is out of control. People think I'm high maintenance. People will think I can't handle challenges. People will think I magnify issues. People will think I'm a loser. People think I'm weak. So all that we hear is people will think, people will think. What about what I will think? What I want? What matters to me? If I want to get help, then I should go for it. Is it worth it for me to think what people will think and put my mental health well-being at stake? So this is something every one of us should ask ourselves, regardless of our age and our gender. If we know that, okay, we are facing with challenges, we need to speak to someone to work out our issues. then we should go and look for it. How can counseling help? So counseling can help us in building our confidence. When we go for counseling, we work together with the counselor to improve our self-esteem, to improve the way we think, to look at things from a positive perspective. It helps us manage our emotions better. Before counseling, we were not able to control our anger. We lash out at our loved ones. We hurt our loved ones. We lose relationships because of our temper. But once we learn the right way to deal with our anger, to manage it, our relationship with others tends to get better. It improves our behavior. What we were doing was not giving us the result that we want. But after going for counseling, we learn how to reframe it. We learn behaviors that help us to achieve what we want, to get what we want. It improves our independence. We are able to make decisions on our own, not just follow the crowd. We are able to know what's good for us, what works for us. What works for another person does not necessarily work for us. There is this proverb saying that one man's meat is another man's poison. So we are able to make decisions that help us to be a better person. It improves our self-regulation. We are able to self-care. We know when to say no. We know when it is too much for us. It helps us to manage stress in different ways. Example, through meditation, to yoga, through doing a hobby like painting, cooking, listening to music, whatever that works for you, whatever that helps you calm down. It works through our challenges. It gives us clearer picture of our challenges so that we are able to find solutions to our challenges. If we can't find the solution, at least we are able to cope positively with our challenges. So this is what counseling does. How to cope with academic stress during a pandemic. So it's difficult and it's challenging with online classes. So how can we cope with it? Here are a few suggestions how you can try it out and see if it works for you. Plan and prepare for your classes. So before you go for your classes, 2 days or 3 days before your classes, try to read up on the e-materials which have been provided for you. So that when you go for the online class, if the lecturer goes fast, you will be able to understand. Take breaks at regular intervals. So when you have breaks in between your classes, do not just sit and look at your screen or browse your phone. Take a 5-minute break away from all the technology. Just walk, go out to the window there, or just look at the blank wall to cool your eyes off instead of looking at technology. Practice having online study groups to stay connected. Try to form small groups with your course mates. It may be a group of 3 or 4. It can even be 2 of y'all. And you guys can discuss together on the topics which you don't understand, the doubts that you have. So this will be another way how it'll be easier for you to understand during your classes, especially your online classes. Reach out to your professors or lecturers for help whenever necessary. Compile all the questions that you have, all the doubts that you have. Make an appointment with your lecturers or your professors for consultation. If you don't speak up, they won't know. Sometimes lecturers ask during online classes, is there any question? The whole class is silent. There's no answer. So how do you expect the lecturer to know whether you understand or you don't understand? And it's through online class. So reach out. If you don't reach out, we can't help you. We don't know where you're struggling. And maintain good sleeping pattern, which is the most important. Just because we are working from home and we are doing online classes from home, we are attending classes from home, that doesn't mean that we can sleep at 6 a.m. and wake up at 8 a.m. for class. Get your regular sleep, your adequate sleep, which will help to focus better during your classes. So these are some tips which can help you cope during pandemic, especially when you're facing with academic stress. I'm going to show you guys a video. So this is basically about grounding technique. Grounding technique helps you to be calm. You can do it at where you are. You can do it when you're sitting on your bed. You can do it at your study place. Okay. Okay, so how do you do it is first you notice how you're feeling and what you're thinking. You need to find a space, a chair or your bed. Just sit up straight, close your eyes, make sure your surrounding is quiet. Then slow down and connect with your body by taking slow and deep breaths. Refocus on your surrounding by engaging in your five senses, your sight, your sound, your smell, your taste, and your touch. So after that, if you're feeling very stressed, I think when you try this, it helps to calm you down, which will help for you to move on to do your work or your stuff. Okay, that's it from me. So I would just like to say, let's work together in taking care of our mental health well-being. Thank you.
Thank you, Miss Cynthia. I'm sure we have all gained some insightful information. To conclude her slide, she has mentioned obvious issues that has been faced during a pandemic, how to cope a psychological health issue, how counseling helps, and some things that could be done to calm you down. We have now come to the end of our presentations by our speakers. Now we will answer a few questions regarding this webinar that you guys have for us. Starting off, I would like to call Miss Cynthia again to answer some few questions.
Yeah, sure, Fatina.
So one first question is, how can you help your friend if he or she is depressed?
Okay, first of all, you need to know the reason for your friend being depressed. Okay, sometimes people use the word depressed very often and we use it generally. I'm feeling depressed. I'm depressed because this happened. I'm depressed because that happened. Okay, so you need to see the symptoms of your friend being depressed. Okay, first you talk to your friend, ask your friend what's going on, what has happened, how is she feeling these past few days, these few weeks. And when your friend speaks to you and your friend is having certain symptoms like she's unable to sleep, she's unable to eat for a few days, she has lost motivation, she doesn't feel like she wants to do anything, then it will be good to recommend your friend to go and see a professional, because she may be facing some mental health challenges, so that it'll be easier for her to cope. If you start recommending her things, it may work for you, but it may not work for her. So it's better if you recommend your friend to go and see a counselor to get professional help. Bear in mind, you see a counselor doesn't mean you are psycho. Most people get that wrong idea. Oh, I'm going to go and see a counselor, everybody's going to think I'm psycho. No. You go and see a counselor to guide you to cope with your challenges. Hope that helps.
Okay, thank you, Miss Cynthia. And I have another question as well. Isn't alcohol and tobacco one way to release stress that good for mental health?
Okay, too much of everything is never good for our body. Okay, alcohol and tobacco, socially, I won't say it's fine. Everybody got our own opinion. If you take it on moderation and you know how to control your intake. But the part where controlling the intake that becomes a challenge for all of us. Because during this time of pandemic, our anxiety is heightened, our frustration is heightened. We take it once, we feel good. We take it twice, we feel good. And then it starts to be every day. From every day, it goes to every few hours. And then it becomes our breakfast, lunch, and dinner. So everything in moderation. And most important thing, you need to be able to have that control within yourself. Ask yourself, are you willing to say no? Are you willing to say, okay, I can stop myself. One glass is enough today. So that is something for you to think.
Okay, thank you, Miss Cynthia. Now I'll pass it on to Dr. Joel to answer some few questions. So the first question to Dr. Joel is, what is the best motivation or advice to keep us motivated and get used to this online learning, particularly for students that doesn't go out often due to MCO?
Well, to answer to your questions, right, actually, it depends on individual because I believe that everyone is different and the motivators are definitely different as well. So you have to, first of all, you have to think about what stops you from feeling sort of like having the motivation to learn online. If let's say you don't really like to spend, I don't know, most of your time sitting in front of PC, just listen to the lessons, or you think it's very boring, or you need to do something to yourself. It depends on the reason why you feel, online learning, or it's not really your call, right? That's why I say it depends on individual to individual. So one of the advices that I could think of is that, I would say for you to think about motivation, it's really important for you to identify. First of all, you need to identify what really makes you feel interested in certain things, or makes you to feel a bit more happier when you do something. Let's say you have to change your perceptions. I know it's very difficult for you to change your perception, especially now students, whenever you say online classes again, you say, so you have to change how you look at online classes. So perhaps you can start to think about, how I can change my perceptions about online classes. Maybe like I say, because remember earlier on I mentioned about pessimistic optimism and pessimism, right? Maybe online classes is something always very bad to you in your mind. You say, online classes is very boring, I'm not going to learn anything from it. So we have to change your perception. Perhaps you can say, well, not only myself is learning this, what do you call, online classes, but again, my friends, all my friends literally, or people around the world now, not only the hybrid learning, but if we talk about the online learning, most of the people are learning, not only you. So you have to change the perceptions, and then only you can accept things to come to your mind, and hopefully by then you can start to develop your motivations. But again, you yourself have to identify certain things that they can really catch your attention. So that is a very important thing that I can advise to you. I know that nowadays everyone is a bit sort of like you start in whatever you're saying. So you need to find this way to help you to come up from the feelings, and so that you develop a new idea, you develop a new perception, so you can really appreciate this online learning now. I hope I have answered your questions.
Yes. And I have one more question. How to be more proactive and motivated to do productive things since we are stuck at home so long and lose the drive to improve?
Well, a very good question. To be honest with you, I also got affected because of, literally because now we have to work from home. Lectures, some lectures, most of lectures, working from home. But I do know that a lot of students, you cannot go back to campus, and then, you start in your own room. So you are kind of like develop certain like kind of, quite down, that negative feelings, right? So how you become more proactive and motivated to do productive things is, again, there's no one solid way for you to become proactive or motivated. Again, depends on you yourself, what you really like to do. Maybe you need to change a bit of, like I say, the perceptions, because no way you can change the method. The online learning is still there, so there's no way for you to change this medium. The only way is how you change your perceptions. All right, change your perception. So let me share with you some tips, right? Like when I'm now literally we are working from home. So what we do is that we, apart from having this kind of online communication with your colleagues and your friends or your teachers, you need to find a way to develop interest in using this what do you call online platform. I believe that not only you can use the online like Microsoft Teams or Zoom or Webex and for teaching and learning, but you also can use it for chatting with your friends, right? So you try to develop that kind of what do you call interest in yourself, so that whenever you think about Microsoft Teams or Zoom, it's not only about online classes, but again, it's a way for you to meet your loved one, your friends. So I hope that by doing this, perhaps from time to time, you can start developing your interest and you can become more and more productive. Yeah, I hope
Thank
I
you,
have
Dr.
answered.
Joel. Yes, I have one more question. What do you think the long-term impact will be on our frontline health workers?
Well, I would say it is very difficult to say. We at this moment, no one really got affected by COVID-19 or anything like that. Especially not to say about our frontliners, right? Because they are the one sacrificing themselves in dealing with this kind of all sort of difficulties, anything you name it. So even myself, I pay really respect to this individual. So what they can do during this difficult moment, in my opinion, is that again they need to build their resilience. They need to start thinking about resilient factors, which again link back to what I have just said, what I covered earlier on. Start thinking about what they can do, because when the time you can't change the situation, you have to change yourself. You have to change how you think about the situations. You have to change about how you have to think about how you can survive during this COVID-19 pandemic, right? So you yourself is very important, because most of the time individuals, they really not, they got defeated not because of the viruses, but because of they themselves, they give up first. They say, I'm not going to survive this pandemic. Even when they got the contracted with the COVID-19, the first thing that came to their mind, because they're very pessimistic, right? They came to their mind is, I'm going to die, I'm not going to make it, and all these things. So you yourself, you have defeated yourself. So you as an individual, you have to stand up to say, as frontliner, I suppose, you have to say, we can survive, all together we can survive this difficult moment. So you yourself is very important. Resilient factor is very important.
Okay, thank you, Dr. Joel. Now again, I will pass it to Ms. Cynthia.
Yes, Fatina.
So I have a couple more questions to you. First question is, when we were back on campus, can we approach a counselor if our mental health is deteriorating?
Yes, you may. We have a university counselor, Miss Emily Octavia. You can look her up in our uni website. You can also see me because I'm also a licensed and registered counselor. So definitely, yes, you can approach either one of us.
Okay. The second question is, I always get distracted by my surroundings very easily. If I'm studying for the first 20 minutes, then I'm doing something else for the rest of the class time. Sitting in one place facing the screen makes me feel so frustrated.
Okay. So for your case, maybe what you can do is if you get distracted by your surroundings easily, try to find a place, especially when you're doing your class, somewhere where there's less distraction. Maybe if you have your own room inside your own room, and if you can lock the room will be better so that when you are attending for your class, nobody comes in, comes out. Or if you're sharing room, then maybe you can speak to the person that you're sharing. I have class this time, so will it be okay if I get to use the room personally so that I don't get distracted during my class time? Okay, when you sit in one place and you face the screen, you feel frustrated. So maybe while your class is going on, you can just get up and just do some light exercises. You still can listen what your lecturer is saying. So just try to move your arms, your hands, your shoulders, okay, so that you don't feel so cramped. When you're just looking at your screen and you're not moving, you tend to get frustrated because you're just at one position there. So just try to move your body a bit. Don't be so tense like you're going for like a scanning like that for some sort of test. So just loosen up a bit. Okay, stand up. I'm sure your cameras are off during your online classes, so only your lecturer's camera is on. So just stand up at that one place there and just try to move around, do some exercise, a bit light exercise, so that at least you get the blood flowing, you see, so that you don't feel so stressed up.
Okay, I have one last question. What kind of signs would indicate that we should visit a counselor?
Okay, it's different for everybody. Yeah. Okay, I'll give you an example. Say for example, the person has lost the motivation in going for class, doesn't wake up, doesn't groom themselves, okay, just wants to sleep, doesn't want to talk to anybody, okay, isolates themselves. This can be one. Another one is that person may be a cheerful person, a happy person, but the person find it difficult in terms of trusting people, difficult in forming social relationships. So you see, there is two different personalities here, two different scenarios. I mean, both of them would benefit from counseling. So the most important thing is you wanting to reach out. Okay, say that you notice that you feel a bit different. You yourself will know, okay, there is a change in myself. I feel a bit down. I feel lost, and it's going on. It's not just 1 day, 2 days, 3 days. It's going on for a week, 2 weeks, 3 weeks. So then that may be a red flag for you to go and see a counselor. Okay? Sometimes you may not have the red flag, but you just want someone to listen. You just want to just, whatever you have inside, you just want to talk it out. You just want someone to listen. When you say, you share it with your friends, you share it with your families, usually what do? They give you solutions. They give you advice, but you don't want that. You just want somebody to listen without judging you, without giving any advice, just an ear to listen. So you can also see a counselor. Sometimes counseling may not be about fixing problems, fixing solutions. It can also be just a session of just listening, just being present at that moment there and creating that safe space for you to unwind. Hope this helps.
Okay, thank you, Miss Cynthia. I'll pass it to Dr.
Yeah.
Joel again. This will be our last question for this webinar. What do you see the long-lasting psychological effects being across society once this awful period finishes? Will we forget quickly or will it change everything?
Well, very good questions. I thank you for the questions. Actually, this is something we all need to take note. Situation like this, like a pandemic, is not going to be of. I mean, and this is not the first time. Again, it's not the last. I would say this definitely is not the last. Hopefully, finger crossed, we will have more and more vaccine coming out so that to prevent this from happening again. But I guess it will be very difficult. If you look at studies, right, research, right, what we have found over the years is that, sometimes a situation like this, a pandemic like this, outbreak like this, can always predispose individual to certain mental health disorders. Let me give you one example. The typical one that normally nowadays we talk about is depressions, anxiety disorders, but again, it could sort of like link to other, something that maybe I don't know whether some of you have heard it before. It's called post-traumatic stress disorder. The reason why is because of a lot of people during this pandemic, right? They lost their jobs and they lost their loved ones. I don't know. Maybe some of you here, you know someone that they have came across with the situation. So they lost their loved ones. So they really have to accept the fact that now things have changed, right? And which is not a good change lah. I mean, losing someone. Uh, so what they normally face is that kind of stress, which is going to follow them for some time, I suppose. So that's why in mental health, right? I mean, we some mental health professionals, they are trying their best to really see, what can be done to these individuals. Well, if you ask me, definitely everyone is affected by COVID-19. Some is affected by, if you look at the business side, they lost their business, shops closed down. And if you talk about the one of the biggest changes, I would say in education would be the online learning, platform. So previously we not even think about, implementing the full-fledged of this kind of online classes before, only until we had COVID-19. So again, this can all predispose individual to all sort of problems, which we have to be careful with that. And that's why we say we have to take care of our well-being, especially you yourself. Before you really get into this kind of problems, right? What you can do to yourself is you need to really have a strong mind. Not to say about other factors, whether you need to have the financial, the backup and all these things. But again, as an individual, you need to be mentally strong to be prepared for this, what do you call, unpredictable events which might come to your life sooner or later. So again, we have to be optimistic. Again, we have to be resilient. Yeah, thank you.
Okay, thank you, Dr. Joel. Now that concludes our Q&A session for this webinar, and we have reached to the end of our webinar. And I would like to thank our speakers, Dr. Joel and Ms. Cynthia, for taking their time out of and give information about this presentation. And I would like to thank our module lecturer, Mr. Ishwar, and every other lecturer and student who has taken their time and attended this webinar. Please don't forget to fill out the evaluation form that has been attached to the chat box. It would be very much appreciated if you all could fill it out for us. Thank you, everyone, and have a wonderful day.